community sort of transmission is concerned, we will not put all the suspected, potential infected cases for isolation, no. Because of the nature of the disease, that's why, as I said repeatedly, as I'm talking about the general public is concerned, those passengers who are no exception in the sense that they are also put into the society where infection is taking place, right? So we are applying the same policy to those jet, but because of a difference of the risk, as I said, chartered flight is a less risk than the ship. That's why we modify a little bit within the overall policy, but we modify that slightly.
I don't understand. So the chartered flight is less risk. Those people will put up in government hotels. If the ship people are higher risk, why are they being dropped off at the train station?
That's why, as soon as those people who disembark from the ship, as soon as they develop symptoms, as soon as, not the 4 days, as soon as they develop the symptom, they are requested to report the health authority for. But for general public, as I said, 4 days. You wait 4 days.
But we're not talking about the general public.
No, that's why I'm saying that should be consistent policy. Because in Japan, we are not trying to put all the people who suspect, right? We don't know whether into the quarantine or isolation. We know that's our policy.
So last bit, do you think these other countries are making a mistake by quarantining these people?
No. That's Japan's policy. As of,
But policies are either correct or mistaken.
Yeah, I think I would like to confirm that for the other countries who needs additional 14 days for the passengers, because as I mentioned before, they went back, they will go back to their own country after the flight. So at that kind of flight, they got some kind of contamination.
But that's not the only reason they're doing it.
Yeah,
the US isn't letting people back in for 2 weeks if they stay in Japan.
Yeah. So I think that they evaluated, Japanese quarantine was not perfect. So I think as for Japanese policy, we require them to stay at home or hotel for additional 14 days. So that is a home isolation we call. So that is between the institutional isolation or ship isolation, we choose to take the home isolation for the passengers to be disembarked. So, but as for the foreign countries, they would like to contain the infection itself, because most of the passengers who got back their own countries are really exposed to the high risk environment. So I think that is a choice by their own country. So, but in Japan, we chose, to require them to be isolated at their home.
Okay, thank you.
Shigeru from Ph.D. I have 2 questions. One is about the other people who disembarked their cruise ship. So has the Japanese government, they have to confirm one thing for the record. Has the Japanese government confirmed those people who left Japan on chartered flights and tested positive in their home countries had been negative when they disembarked? Because the minister yesterday, he was vague on that point, and he said that those people who left Japan were a mixture of people whose results were yet to come, or who had close contact with the people who tested positive. So it's a vague thing. Japan, in my understanding, Japan has never confirmed that those people who tested positive in their own countries have been absolutely negative when they left Japan. And then my second question is it's about the Olympics. So what criteria will need to be met for the games to go ahead? For example, no new cases for a certain period, or significant drop in the numbers, or do you think the games can go ahead if the situation then is as it is now?
So for the first question, I cannot remember all the criteria for each evacuated by their own country, but some countries evacuate the passengers who got test negative, and also who didn't get tested, and also who has a status as close contact. So for some countries, so that means we did our best to notify each country the result of the test, PCR test. But at the last moment, we could not notify, before their flight left Japan. So on that kind of cases, we notified each country the test result after they went back to their own country. So for some countries, I repeat, for some countries, they evacuated passengers who got test negative and also close contact, and the passenger who didn't get tested. And also who got tested but not yet have result yet.
So what about the Australians? Can you say they were not all negative, or what's your latest situation? Because the Japanese government said they are trying to check what actually happened.
As for now, I'm sorry, but I cannot, I cannot say the exact information for Australian cases. But so sorry for that. I need to check up with my colleagues for that, as for the Australian cases.
No. Olympic? So you are interested in Olympic, right? We all are interested in the Olympic. Of course, we hope that everybody, I'm sure, hopes that the transmission will subside before. That's everybody's sincere hope. But now, I like to, before answering your questions directly, I like to put the current sort of community transmission situation, into more overall perspective. Our assessment is we are at crossroad. This coming 1 week or 2 weeks or 3 weeks are very crucial. And there are, of course, possibility that expansion, as escalation, the speed of the expansion is very, rapid like that. That is one scenario. Of course, that's worst case scenario. And the best case scenario is that we slow down, as minimum as possible. And now we are at crossroad. That's why it is too early to predict. Of course, we like to know when this outbreak, this transmission come to an end. I would like to know, but before sort of making a best estimate, what we have to do is we have to consent everybody. Japanese Medical Society, citizens cooperation is crucial. Medical circle, everybody, public sector like him, both central government, local authority, citizens, and journalism also should come on board. So we are no luxury to making so we now at crossroad. That's why we now should concentrate on doing everything required to reduce the speed of the expansion. It is just impossible to stop the expansion. It is just impossible. We have to accept the reality because of the nature of this disease. Anybody can be at the risk. So we should not have an illusion. We cannot stop this. But we can do is to try to reduce the speed of the expansion and also to reduce the mortality. That's our two major objectives, and we should concentrate on achieving these two objectives. That's why it's a bit too early to think about the Olympic time.
Could I ask a follow-up to that? That's all. Go ahead.
Rocky Swift of Reuters. A couple weeks ago, Health Minister Kato said that the WHO had acknowledged Japan's request to keep the Diamond Princess cases as separate from the domestic total for Japan. And that's a very big difference. It's the difference between maybe 30 cases in Japan and 330, or now over 700. So from an outside perspective, it looks like maybe that's politically motivated so as to keep Japan's number low. So can you respond to that? Was the quarantine done on the ship so as to give the appearance, at least statistically, of a lower contagion count in Japan? Thank you.
I heard that that during the discussion at WHO headquarters in Geneva, some countries insisted that if we count the infectious cases on the ship on each country, each country don't want the ship went into their own country. So that drawback is that most of the country reject the ship to if they have some suspected passengers. So I heard that during the discussion in WHO, if they concluded that the cases on the ship should be excluded from each country's cases, because if we count it on each country's cases, most of the countries don't want the cruise ship to arrive on each country because the suspected patients, if the suspected patient on board the ship.
But of course, if somebody, this gentleman or lady does not, then if somebody left, disembarked, by the time that they disembarked, no symptom, no positive test. But afterward, they developed the symptom and tested positive. If that is counted a local case, right? Yeah. That is, of course, it's after the quarantine. So that if the infection happened after disembarkation, that is counted a national case. It's a very rational.
The woman in Shigeru picture is a local case?
Local means national case, not
Not
excluded.
So now the number on the ship is 100.
Also, can you raise hands before asking a question, please? Okay.
Just sorry, the quick follow-up on the ship's case. So the latest number should be 691 cases, including 57 cases announced last night. Am I right?
Yep, that's right.
Excluding the Tochigi women or including?
I think it is included.
Yeah, included in this 691.
Hi, Wang from Xinhua. This question for Dr. Omi. Yes, you said that if someone has symptoms or in the first four days, they don't have to report to the authorities or is this do you mean that this in the first 4 days the person is safe from this disease? And is this a decision that you made from the information from China, from other countries you shared? The second question is that what medicine, what measures do treat those who have infected after 4 days or after those have serious symptoms? Thank you.
You know, this 4-day national policy, this type of policy should be on the analysis of the data available, right? I mean, this you should have some sort of rationale behind this kind of policy, isn't it? You cannot put any policy in place. You should have a basis for any policy, isn't it? So this time, he will supplement. He's seen several patients and his colleagues. And based upon analysis of the all cases, majority of the cases, you know, for majority of cases, there is light symptom like as fever, cough, for 5 days, 1 week. Then afterwards, unfortunately, some people began their cells, and many people, majority, become less mild, and some of them recover. So this is the data, clinical data, collected by those gentlemen. So,
sorry, is this data from only from Japan or also from China?
Oh, I see. That okay, that one.
Both, for the